I'm Sara Konrad Baranowski, editor of the Times-Citizen, and Dr. Katie Haverkamp is joining me today, and we are going to talk about COVID, all things COVID. Um, so I thought, Katie, we would just start off with, I mean, you're talking to a lot of people about COVID right now. So are there questions that you're hearing over and over again from people, like misunderstandings or things that you want to clarify?
Right. Yes. So thinking of how we are together today, and I was thinking, gosh, if I could have one unified message out there or something that I repeat day in and day out that people didn't understand or something to clarify, it would be, what do I do if I think I'm sick? And what do I do with my results? So I would start out with, if you think you are sick, we live in Rona world. So if you think you're sick, you should act like you're sick, and you should assume you have coronavirus until you are told you do not. So basically, even if you think it's your allergies, even if you think, oh gosh, I was working out in the yard and it was really cold outside and now I'm coughing because of this, no free passes during this time. I can't tell you how many times I've heard, I thought it was my usual bronchitis I get every time this year, or I thought it was my allergies, or I thought it was just a cold. Again, we have to all assume that it's coronavirus unless we know otherwise. So I would agree that everyone should just stop what they're doing. If they think they're sick, hole up, self-isolate, and contact their healthcare provider about next instructions. Number one, if you think you're sick, you just don't want to share your breath with others. Coronavirus is very simple in that if you share your breath, you're at risk of contracting it or transmitting it. So if you think you're sick, don't share your breath with others. Maintain social distancing, stay at your home, self-isolate, don't touch other things that other people touch. Just wear your mask if you have to be around people, but basically self-isolate. Once you contact your provider or seek testing, okay, there's a lot of, we can go, testing's another whole half an hour,
Yeah.
but we do testing here in Iowa Falls. We also do it at the Hy-Vee, or there's a lot of other Test Iowa sites and such. Basically, the quicker we can get your test, the quicker we can get your result, the quicker we can isolate your contacts, the quicker that we can isolate you. And that's how we stop the spread, is having people not share their breath that have the COVID.
So, I mean, and I think there are so many symptoms with this too, right? That, you could say, oh, I always get a sinus infection this time of the year, or it's harvest season, so my allergies are kind of crazy. But that, I mean, you have seen people who have symptoms that mirror allergies or a sinus infection that turn out to be COVID.
Absolutely. So there's something called normalcy bias. Basically, it's something that says we can explain things away. Hey, that really wasn't, something that I heard in the other room. I really don't have an intruder. We always think, okay, that was the wind or whatever. But with coronavirus, it's the same thing, normalcy bias. We want things to be normal, so we explain things away. I can't tell you how many times I've heard from people, I thought it was just a cold, so I kept going to work. I wore my mask and everything, but now it's not going away, or now my partner has COVID, or now my kid has COVID, and then they reflexively test only because of another circumstance. And then there was that potential exposure, because although masking helps, masking's not perfect. So if you have symptoms, nobody wants to hang around with you.
Yeah. And so if you've called your provider says, yes, you need a test, you get the test, it comes back positive, what happens then?
Okay, so a positive test means that you have coronavirus. So if you're positive, you want to self-isolate from 10 days from either your symptom onset if you have symptoms, or your positive test if you have no symptoms. And you have to be 10 days from either one of those things, symptom onset or positive test. And then if it's 10 days and you have 24 hours without a fever and your symptoms are improving, you don't have to be 100%, but you have to be improving, and 24 hours without a fever without Tylenol or ibuprofen. So those are
it's not, I took the test and 2 days later, I feel so much better and my symptoms are all gone, I can go out. You still have to wait the 10 days from either symptom onset or positive test.
Amen, sister. Yes, thank you for clarifying, because yes, you can feel great, and that's the problem. On goes the pandemic, everybody, because everybody feels okay, and it's so very hard to stay at home or not do your usual activities if you're feeling well. I mean, the 10-day self-isolation is bad enough, but quarantine, man, that's a huge, horrible pill to swallow when you're feeling well. But it's so very, very important to help stop the spread of the virus.
Right. And then there's
So, okay,
go ahead.
So, that's your rules. But what we also need to really go through is the self-quarantine portion of it. Or what do you do? What's your responsibility to the others around you or that you could have potentially exposed? We would like to think we have enough contact tracers in Hardin County that as soon as we get a positive test, somebody's calling all the people that we were around and tracing them back and telling them what to do. But unfortunately, through manpower and other things, we're just not able to do that on a timely basis. So what I recommend, if somebody has a positive test, that they start making a list and they start talking about who they've been exposed to or who they could have exposed for 48 hours before their symptom onset or their positive test. Because you're actually most contagious, again, you're most contagious before you have symptoms. For 48 hours before symptoms, you are the most contagious. I can't say that enough. So people think, oh gosh, only since I've been sick, who have I been by? But no, yeah, time out, back the bus up. We need to talk about 48 hours before. And those are the people that are most at risk of getting it from you. And I think it's our personal responsibility with a positive test to contact those people and say, hey, I got the Rona. We were together doing this, that, and the other thing, or, my doctor recommends that you self-quarantine for 14 days. And they're going to say, what? And you're going to say, yeah, I know, it's a real big bummer. But CDC guidelines, if we're going to slow this virus, those people are now 14-day incubators of the virus potentially. So we can go through what quarantine looks like as well, if you'd like. But
yeah, well, I was also going to ask, so if you get your positive test back and you're thinking about recent days, what qualifies as a close contact? Maybe you went to the grocery, like you're wearing a mask when you're outside your house. Do you still need to notify everyone that you stopped and talked to while you were wearing your mask outside your house?
Okay, so from the CDC, the guideline for an exposure, and again, this is a guideline rather than a hard pass, but if you're around somebody for 15 minutes, masked or unmasked, and within 6 feet of them for 15 minutes or more in a 24-hour period, that's considered an exposure. So if you say worked at an office and you stop by this person's desk and talk to them just a couple minutes here and a couple minutes there, sat across from them at lunch or what have you, but if that could have added up to 15 minutes, and this isn't a, hey, okay, let's put our timers on. We're not going to be around each other more than 10 minutes. Use your brain. Use your thought that, like, hey, was I close enough to them that our breaths could have exchanged in any sort of meaningful manner? And if the answer to that is yes, and the guideline is, again, the 15 minutes for within 6 feet for 20 in a 24-hour period. But, again, you got to use your common sense on this. And, that's hard stuff.
Yeah. So you started to mention the quarantine aspect, and let's dive into that because I think there's quite a bit of misunderstanding about it. And,
right.
Like you said, it's a bummer to quarantine, but it's so important because you're contagious those 48 hours before you feel symptoms.
Right. So, those in quarantine are like, dang, what am I supposed to do? Am I not supposed to go to work? Well, I can't do that. And never, I can't tell you how many times I hear, well, that's not reasonable, for so-and-so not to work, for 14 days or whatever. Well, again, that's why it's so important that we not have those contacts or have to make those phone calls in the beginning, because think of how many people that either inconveniences, pulls out of school, they're not making money for 2 weeks because they can't go to their job. You talk about economic impact here. We can, if we're going to look at this from an economy standpoint, if we all mask up, keep our distance and everything, everybody can keep going to work, everybody, that's hard and fast. But if you're in quarantine or if you've been exposed, you're 14 days out of work. I'm digressing, aren't I?
But if say I get a call from somebody at work who I talked to for 20 minutes and they say, hey, I tested positive. My doctor says that you should quarantine. What does that mean?
Okay. So to quarantine means basically, again, you shouldn't share your breath with others for 14 days. depending on your work, depending on if you're an essential or a critical infrastructure employee, or depending on what your work guidance gives you, you may actually be able to go to work under certain circumstances. But you should stay away from everyone for 14 days. You shouldn't be going to the Tysons even if you mask up. You shouldn't be going to the Hy-Vee. You shouldn't be walking with your best friend. You should be basically be holing up. You shouldn't be out. And that's the hardest part. I think it's not hard to stay in bed if you're feeling bad. It's hard to stay away and stay in a house if you're feeling great. And that's where I think we really kind of drop the ball, and that's where things spread. Because there's a lot of things that we really want to do, everybody wants to be out and about, everybody wants to be with their friends. And, I wasn't, and everybody can talk themselves out, remember the normalcy bias. Everybody can talk themselves out of, oh, I really wasn't around them that much, or he was around the corner, or he was kitty wampus from me at the table at the bar rather than right across from me, so I should be cool. It's those types of things that everybody can talk themselves out of. But again, it's a lot easier not to put yourself in quarantine rather than to be in quarantine. So if it means anything for us as a lesson, it means, wear your mask and social distance so you're never in that position.
So how are things at the hospital and the clinic? I mean, you clearly have seen an increase in cases in recent weeks. I mean, how bad is this?
Okay, so from a testing standpoint, I can tell you that we're probably doing triple what we were doing 2 or 3 weeks ago. And testing for one part of our test, our test that we've been doing from the get-go, we're running low on, so we're switching to an antigen test. And again, so if that dries up, then we're kind of in another pickle. But right now, we're doing okay. So we're doing about triple the amount of testing. The hospital itself has picked up not only because of COVID, but because of other things that go along with winter, and people fall down, and people have pneumonia, and all those sorts of. So not only the usual things that keep you busy, but now it's not necessarily hitting Hansen Family Hospital to a critical stage, but on this trajectory, which is going so very quickly up, it's going to overwhelm us within a week or two. Right now, if you have COVID and you're in my hospital and you need admitted, we can't find an outside hospital for you. You are in our nest. We can do certain things here in Hansen Family Hospital, but we don't have an intensive care unit. We don't have a cardiologist. We don't have certain things, but we can certainly give you remdesivir, and we can certainly give you dexamethasone, and we can give you oxygen and fluids and all those things. But if those things aren't working for you, then we try and find another place for you, which is hard to find. I mean, you if anybody's watching the news, they're seeing all these doctors go on WHO 13, and they're pleading with the governor, they're pleading with the public to do the right thing, to mask up, to slow the spread, for a mask mandate. I mean, and this is not political at all. I mean, this is just a public health thing. Somebody had told me I was thinking the other day, and this is like a war with an invisible enemy. We've lost more to the coronavirus in 9 months than 6 times more casualties to the coronavirus in 9 months than we did all of the Vietnam War. And yet everybody seems to think that it's okay to put our people out to slaughter. Okay, when we had a war with World War II, like within the span of a week, we were asking to take our sons overseas and fight. And now we're asking people to put a face covering on for this war. I mean, that's what's super sad to me.
Yeah.
That's what's super frustrating.
So if people, I mean, as people realize how bad this is, or recognize how bad this is getting, and they want to take steps, obviously, I mean, wear a face covering, don't go out if you don't have to, distance from others.
Right.
I mean, what other advice do you have?
Keep yourself healthy, continue to exercise, continue to be mentally healthy, continue to connect with your people, even if you're not physically seeing your people, see your people, outside, see your people, and I know it's cold, I get it, it's winter, but you know what, we can all put a coat on, and we can dress for the weather, get fresh air, wash your surfaces, frequently with, that everybody touches, the light switches, the remote controls, the faucets, of course, if you live alone. But whenever you come in from the outside, like from the grocery store or what have you, wash your hands right away, 20 seconds with soap and water, and or with a hand sanitizer. But take care of yourself. You know, those are the things that you can do. And again, I don't want the economy to close. I don't want the schools to close. I think that those are super important things, but we can slow the spread, and we can keep everybody open, and we can keep things moving along. And nobody's trying to get rid of the virus either, because it's kind of, you know, it's, yeah, cat's out of the bag, everybody. But we can keep from overwhelming our healthcare system. And man, that vaccine is so close, and that vaccine looks like it's going to rock. Okay, so I'm super excited about the vaccine. I'm super excited about new antibody treatments. So help is on the way. But if we can just be diligent through this winter until we can launch this vaccine out, I think that that's going to be a game changer for us.
Right. So you were talking a little bit about testing, and, you know, at Hansen Family Hospital, you're only testing people who are symptomatic, right? That's correct. I mean, your research. Okay. So if you have been exposed to someone, and we talked about this a few days ago, if you've been exposed to someone who turns out to be COVID positive, and you say, oh, I'm going to run out and get a test and it'll come back negative, and then I'm good to go. But that's not true.
Yeah. Do not pass go, do not collect $200. Yes.
Right. And so I think that to me was valuable information, because I think some people say, oh, I was exposed, I'll wait a couple of days, I'll go get tested. My test came back negative, I can go back to work, I don't need to worry anymore. But that's not true.
Right. No, I've seen people. Okay. So yeah, COVID jail is COVID jail, and equals quarantine. So you can be negative on day 3 after your exposure, negative 5 days after exposure, 7 days, and trip positive on day 10 or 14. I've seen it happen. I've seen people with severe disease. I've seen people that are still suffering today that were sick in July from a similar situation. So although it's reassuring, you're like, whew, I don't have the Rona, but it doesn't get you out of that quarantine, and it doesn't alleviate you from what we need to do as a society. I think it's also important to talk about, okay, so I live in a house full of people. What does that mean? If I'm going to self-isolate, or I'm going to quarantine, and I've got 2 littles, and I've got 2 teenagers, what does that look like? It's hard. It's truly hard. But if you have a place where you can nest up, you know, if you have a closet you can climb in, if you have somewhere where you can not share your breath with other people, sleep with other people, go to the bathroom where other people aren't going, or be able to have your Clorox wipes and wipe behind you, that would be best. And if you have to go into a common area where other people might be or have been, wear your mask in that area. Because they're, you know, if you trip positive, or if you're positive and you're sharing space with them, their quarantine starts, their quarantine starts 10 or 14 days after their last contact with you. Okay, so this is the worst case scenario. Okay, mom comes home with the Rona. She's got 2 teenage kids. All right, and nobody was able to self-quarantine. Mom is contagious for 10 days. Then their 14-day quarantine starts after that. So that's 24 days where those kids ain't going nowhere. And then if dad trips positive halfway through, then that's another 10 days and another 14 days, you know? So people could be at home for a month together if they're not able to quarantine out. So it's messy. So you can see the valuable, you can see the benefit of not being put in quarantine to begin with.
Right. But the other side of that is, if you don't follow those strict and uncomfortable and inconvenient numbers, you send your teenagers back to school, and they might give it to others or whatever. You go out in the world and you spread it, and we overwhelm our healthcare system.
Right. Right. And, you know, the thing is that what's also frustrating to me is we might not think it's a big deal for us, and it's super inconvenient, and I don't like this, and I don't care about the virus, and I don't, you know, I don't think it's going to affect me. That's not helpful to our community, because you unknowingly then are spreading it to an elderly person or somebody else that's otherwise healthy that happens to have a really crappy outcome. You know, it's just, yeah, it's better to wear your shield, man. Going out to war, it's better to wear your bulletproof vest. going out to a gunfight. You know, it's just
Yeah.
so important.
We talked, so can we talk about face coverings for a minute also? Because
Yeah.
I asked you about this. I went out for a run a couple of days ago. I want to be like conscious of other people. I don't know if I have the virus. So I was wearing a buff and I just pulled it up like if I saw people. But buffs aren't necessarily effective. So, I mean, you know, I kind of thought whenever I'm outside of the house, I should be wearing a mask. But are there situations where I don't need to wear a mask outside the house? Like I just don't know. Like walk out
Yeah.
the door, put it on, don't take it off until you walk back in.
Right. Well, again, we have to use some common sense. Some people feel most comfortable wearing a face covering all the time when they're outside of their home, and that would be the most conservative, and that would be okay. But we don't live in New York City. We don't live in Chicago. When we go out for a walk, or when we are, you know, out and about in Iowa Falls, Iowa, we have plenty of room to spread out. Right. So if you see somebody coming, you take you take this street, or you take that street, or whatever. We're not, we're not elbow to elbow when we're out and exercising. So I think it's fine if you're going out and taking your dog for a walk, not to wear your face covering, but to have a face covering with you. Because Bobby always comes over to say hi and wants to pet your dog and talk to you about whatever's happening around, at work or whatever. So you can flip it on and just be safe that way. And of course, if Bobby stops to talk to you, of course, put your face covering on and back up. And, you're going to always have those people that want to lean in, and then you're going to just back up. And then, there's a learning curve. It's learning for everybody, So, I mean, I think we have to give each other a lot of grace. There's a lot of people that weren't really fans of masks to begin with, didn't see why we were, but I mean, there's no shame in that. I mean, there's a learning curve to this. So, I mean, the times are what they are. And this is just where we need to be right now. So no, okay. So I don't think that you need to, if you're going out on a walk, if you're going out with your best buddy and you guys are shoulder to shoulder, yeah, wear your mask. Plus it's winter time and it's kind of warm. So it's kind of nice that way. But to talk about masks, what are the best masks? Buffs and bandanas are not very good. Anything that's single ply or very thin, or that you can hold up to the light and see through, not very good. If you have a cloth mask, you want to make sure it's at least a couple of layers thick. Okay. And, or the disposable ones are very, very good. They kind of have the little nose thing. Yeah. And if you're like, I can't breathe through those things, I can't do it, I just get claustrophobic, I get anxious or whatever, I would encourage you to try it at home. When you're sitting there watching TV, you're watching whatever Law and Order, and, you're just sitting there breathing, doing nothing, wear it then, and then your body gets used to that, and then wear it while you're doing your chores, and then wear it while practice going up and down the stairs a couple of times. And I know it causes fogging of the glasses, so try it with your glasses and figure out, but there's a learning curve to it. Okay, so I mean, you can wear it a certain way where it doesn't. Okay, but news flash, everybody, okay, I know that this might be weird, it only works when you cover all of the breathing holes. Okay, this one, and this one. Okay, if you're not covering all three of the breathing holes, ain't working. Okay, because so people that wear it, put it under their nose so that they can breathe. What hole is closed when you're doing that? This one. Which one's covered? This one. So I mean, the nose holes are connected to the lungs as well. They need to be covered. Okay, that's cheating. That's not effective. We need to cover all of it all the time. And I would just really encourage people that aren't good about this, or don't have to do it a lot and feel uncomfortable with it, practice. And, get a couple different masks, because you know what? Some of them are really super crappy and they fall down all the time and they're uncomfortable, or they, whatever. Find the one that works for you. I mean, they're everywhere. And I know that if you go into the Walmart or the Hy-Vee, they have the mask sitting there. Pick up a disposable one. Those are the ones I wear most of the time and I love, because they are disposable, because they have the little nose thing that fits, because they are very comfortable and they're uniform. So I love those. And you can get like a box of 20 for them for like less than $15 on Amazon. So,
so when you're outside in Iowa Falls, you don't necessarily have to wear a mask or a face covering, but if you're going inside anywhere, you should wear a face covering.
Right. And it's very important to also to get good at wearing your mask so you're not adjusting it all the time. Because by rights, if you're adjusting it all the time, now you got all little COVID mittens. Okay. Nobody wants to touch your COVID mittens. So every time that you touch your mask, you probably want to have your hand sanitizer and do that. So not only do you want to have your mask with you, you want to have your own hand sanitizer. Most businesses and things have hand sanitizer there too, but that's why it's important to practice at home so that you can have a mask that fits your nose well, and so that you don't have to adjust, so that you feel comfortable with it where you're not doing this all the time.
Yeah.
But and yeah, on another thing, on another day or another thing, we can talk about Thanksgiving and Christmas and family gatherings, and maybe, you know, maybe another time. But there's a lot of good hacks on that too, because you know what, it's hard right now, and people need people, and we need to connect with our loved ones, but it just has to look different if we're going to be safe.
Well, Katie, thank you so much for agreeing to do this. I think it's great to have someone, a local doctor who can talk to us about it, because it's one thing to have, you know, to hear it from the CDC or to hear it, you know, different stories or different instructions from different people. But, you know, someone here in Iowa Falls who we all know and trust, I think is a little bit different.
Yeah, no, I would be happy to do any question answer things, get on again and talk, and, you know, answer questions, because, you know, knowledge is power. And we get so many mixed messages that I think if we can kind of all agree on one set of messages and proven things that work. And again, we're not asking for a lot. We're just asking for uniformity and community support, and all this, you know, it works if we all do it together.
Yeah. Well, thank you.
All right, you take care.